7 Safe Ways Baking Soda Can Support Senior Health, Senior Care. As we age, we learn that true health isn't about chasing trends or quick fixes. It's about listening to our body's quiet signals and responding with care, wisdom, and simplicity. For many of you watching tonight, over 50 and navigating the challenges of aging, you know this truth deeply. You felt the sting of heartburn after a favorite meal, the ache of stiff joints, or the frustration of a urinary tract infection that steals your peace. These moments aren't just discomforts, they're reminders of how much you value your independence, your dignity, and your ability to live fully. What if a humble kitchen staple, something as familiar as baking soda, could offer gentle support for these challenges? Baking soda, or sodium bicarbonate, isn't a miracle. It's a time-tested tool, backed by science, that generations have used to ease everyday ailments. I've seen patients light up when they discover simple, natural options that complement their care. This video is for you, seniors who want practical, safe ways to support your health while honoring your body's needs. We'll explore 7 evidence-based ways baking soda may help. From soothing digestion to supporting oral health, always with clear guidance to ensure safety. Every step will come with a reminder: consult your doctor before trying anything new. Especially if you have conditions like high blood pressure or kidney disease. This isn't about replacing medical care, it's about empowering you with knowledge to make informed choices. Before we begin, if you're new here, please hit the subscribe button and ring the bell so you never miss a health tip crafted for you. If you find this video helpful, type 1 in the comments. If not, type 0 to share how I can improve. Let's dive into the gentle power of baking soda, starting with a benefit that touches so many seniors' lives. 1. Relieve heartburn and acid reflux. For countless seniors, heartburn is more than an occasional nuisance, it's a frequent companion, especially in the evening. That burning sensation rising behind your breastbone, creeping toward your throat, can disrupt sleep, sour your mood, and make you reach for antacids without a second thought. I've worked with patients who felt resigned to this discomfort, accepting it as part of aging. But what if a gentle remedy, sitting in your kitchen cabinet, could offer relief without relying solely on pills? Baking soda has a remarkable ability to neutralize stomach acid. When mixed with water, typically half a teaspoon in a glass, it forms an alkaline solution that calms the fire of acid reflux. When sodium bicarbonate meets excess hydrochloric acid in your stomach, it produces salt, water, and carbon dioxide, easing the burn within minutes. A 2017 study published in the Journal of Clinical Gastroenterology noted that sodium bicarbonate can provide rapid relief for occasional heartburn, making it a practical option for many. Imagine finishing a rich dinner, perhaps one with tomato sauce or spicy chili, and sipping a warm baking soda drink instead of dreading that familiar discomfort. For seniors managing multiple medications, this natural, affordable solution feels like reclaiming a bit of control. No pharmacy trip, no complex side effects, just a moment of peace. In my practice, I've seen patients smile with relief when they find something so simple works so well. However, baking soda is not for daily use or everyone. It contains sodium, which can be risky for those with high blood pressure, kidney issues, or heart conditions. A 2019 review in Hypertension warned that excess sodium can worsen these conditions. Always consult your doctor before trying this, especially if you're on a low-sodium diet or have chronic health issues. Use it only for occasional relief, such as after a heavy meal. And never exceed recommended doses, typically half a teaspoon in 4 ounces of water, once or twice a month. This gentle remedy is just the beginning. As we explore baking soda's potential, let's turn to another vital area for seniors. 2. Support kidney function. As we grow older, we become more aware of the systems that have quietly sustained us for decades. Your kidneys, filtering waste, balancing fluids, and maintaining your body's acid-alkaline harmony, are among the most critical. Yet, with age, especially alongside conditions like diabetes or high blood pressure, kidney function can decline. Subtle signs: fatigue, swollen ankles, changes in urination, and feel helpless, wondering if this is just aging's toll. Baking soda enters this conversation in a surprising way. Research, like a 2018 study in the Journal of the American Society of Nephrology, suggests that small Medically supervised doses of sodium bicarbonate may support early-stage chronic kidney disease, CKD. As kidney function wanes, the body struggles to clear acid from the blood, leading to metabolic acidosis, a condition that accelerates kidney damage. Baking soda acts as a buffer, neutralizing excess acid and potentially slowing disease progression. In this study, CKD patients taking sodium bicarbonate had a slower decline in kidney function, with some avoiding dialysis longer. For seniors, this offers hope, not a cure, but a way to support your kidneys naturally. Picture giving these vital organs a gentle assist, not with complex drugs but with a familiar powder dissolved in water. In my experience, patients feel empowered when they learn small steps can make a difference, especially when managing multiple prescriptions. Baking soda's sodium content can harm those with advanced kidney disease, heart failure, or fluid retention. A 2020 article in Kidney International emphasized the need for medical oversight. Consult your healthcare provider before considering this, and never use it without a doctor's guidance. Blood tests to monitor kidney function and sodium levels are essential. If you're finding these insights valuable, please comment one below to let me know you're with me. Next, let's explore how baking soda may ease another particularly draining issue for many seniors. 3. Ease urinary tract discomfort. Few discomforts are as disruptive for seniors, especially women, as a urinary tract infection, UTI. That burning sensation, urgent need to urinate, and pelvic discomfort can erode sleep, dignity, and peace of mind. Countless patients who felt trapped by recurring UTIs, frustrated by symptoms that linger between treatments. While antibiotics are the cornerstone of care, what if a simple, supportive step could ease discomfort in the interim? Baking soda, when dissolved in water, raises urine pH, creating a less hospitable environment for bacteria like E. coli, which thrive in acidic conditions. A 2016 study in urology found that women with frequent UTIs who used sodium bicarbonate, alongside standard care, reported fewer flare-ups and less burning. This isn't a cure. UTIs require medical attention, but a half teaspoon in a glass of water may reduce irritation for those with chronic symptoms, offering a sense of control while awaiting treatment. For seniors juggling medications or facing delays in doctor visits, this small act can feel like a lifeline. I recall a patient who described the relief of feeling normal again, after using a baking soda rinse between appointments. It's not about replacing care but complementing it with something accessible. UTIs can escalate quickly in older adults, especially those with diabetes or catheter use. A 2021 Journal of the American Geriatric Society article highlighted the risk of untreated UTIs leading to sepsis. Consult your doctor before using baking soda, and seek immediate care for symptoms like fever or back pain. Use only under medical guidance, typically no more than once daily for short periods. Let's move to another painful challenge many seniors face, and how baking soda might offer gentle relief. 4. Help with gout flares. If you've ever woken to a joint so swollen and painful that a bedsheet feels unbearable, you know gout's cruelty. For seniors, these sudden flares, often in the big toe, ankle, or knee, feel like a betrayal, especially after efforts to eat well and stay active. Many seniors despair over gout's unpredictability, wondering if they'll ever regain ease of movement. Gout stems from uric acid buildup, which crystallizes in joints, triggering intense inflammation. Baking soda's alkalinity may help by making uric acid more soluble, easing its excretion through urine. A 2019 study in rheumatology found that sodium bicarbonate, under medical supervision, reduced uric acid levels in some gout patients, potentially decreasing flare frequency. This isn't a replacement for medications like allopurinol, but a complementary step to support prevention. For seniors, stirring a teaspoon of baking soda into water becomes more than a remedy. It's a moment of empowerment, a way to honor your body's signals. Gout management requires medical oversight. Baking soda's sodium can worsen heart or kidney conditions, as noted in a 2020 Arthritis Care and Research Review. Always consult your doctor, and never use baking soda as a primary treatment. Monitor for side effects like swelling or shortness of breath. Now, let's explore how baking soda can soothe a subtler but no less significant issue. 5. Soothe mouth sores and bad breath. As we age, we become more attuned to small discomforts that can erode confidence. A lingering canker sore, a dry or bitter taste in the mouth, or the quiet worry that our breath isn't fresh. For seniors, these issues, often linked to medications, dentures, or dry mouth, are more than physical, they affect how we connect with others. I've had patients share the embarrassment of avoiding conversation, fearing their breath might betray them. Sodium bicarbonate neutralizes acids in the mouth, creating an environment where odor-causing bacteria struggle to thrive. A 2018 study in the Journal of Dental Research found that a baking soda rinse reduced oral bacteria and soothed the irritation from mouth ulcers. To use it, mix half a teaspoon in a glass of warm water for a gentle rinse that eases the stinging of sores and freshens breath without the harsh burn of alcohol-based mouthwashes. For seniors dealing with dry mouth from medications like antihypertensives, this rinse can feel calming, even restorative, bringing ease to social interactions. Many patients rediscover joy in small rituals like this, a daily rinse that feels like an act of self-respect. It's a reminder that even minor discomforts deserve attention. That dignity isn't just about avoiding disease but about feeling whole, from your joints to your smile. However, overusing a baking soda rinse can disrupt the mouth's natural pH or irritate tissues, as noted in a 2020 article in Oral Health. Use it no more than twice daily, and consult your dentist if sores persist beyond a week or worsen. Those with sodium restrictions should seek medical advice before regular use. Let's move to a benefit that supports active seniors. 6. Reduce post-exercise soreness. For many seniors, staying active is a precious gift, a way to maintain independence. Keep the heart strong, and stay connected to life's rhythm. Whether it's a morning walk, gardening in the afternoon sun, or gentle stretches during physical therapy, movement brings freedom. But with that freedom often comes soreness, the kind that creeps in a day later. Stiffening joints and tightening muscles. After physical activity, your muscles accumulate lactic acid, contributing to the achy, burning sensation known as delayed onset muscle soreness. A 2017 study in the Journal of Sports Sciences found that sodium bicarbonate, taken post-workout, reduced acid buildup in some athletes, easing soreness. For seniors, drinking a small glass of baking soda water, half a teaspoon in 4 ounces, shortly after exercise may soften this discomfort, helping you return to your activities with less hesitation. This isn't about erasing fatigue but about softening its edge, allowing you to stand taller and move more freely the next day. A patient, after incorporating this into her routine, felt confident resuming her daily walks, reclaiming her sense of vitality. It's a small act of care, a teaspoon in water, a quiet sip, that feels natural, not forced, offering psychological comfort alongside physical relief. Again, consult your doctor before trying this remedy, especially if you have heart, kidney, or blood pressure issues. Use baking soda sparingly, only post-exercise, and monitor for side effects like bloating or discomfort. Stop use and seek medical advice if these occur. Now, let's explore baking soda's role in a foundational aspect of health. 7. Support balanced body pH. Your body is a marvel of balance, orchestrating countless processes to keep you thriving. One critical aspect, often overlooked, is pH, the acid-alkaline harmony of your blood and tissues. As we age, this balance can tilt toward acidity, especially with modern diets heavy in meats, sugars, and processed foods, or with stress and medications. Many seniors struggle with fatigue, achiness, or inflammation without realizing that pH imbalance may contribute. In small, supervised doses, sodium bicarbonate acts as an alkaline buffer, helping to neutralize excess acids in the body's tissues. A 2020 study in Frontiers in Physiology suggested that sodium bicarbonate may support pH balance in older adults, potentially improving energy levels and reducing inflammation. Seniors who incorporate a baking soda drink half a teaspoon in a glass of water a few times a week, often report feeling clearer, lighter, and more energized. This approach isn't about chasing extremes, like turning your body into an alkaline machine as some fads suggest. It's about gentle support, helping your body do what it's designed to do with a little less struggle. In my career, I've learned that small, consistent steps can transform how patients feel. And this is one such step, offering a sense of balance that supports digestion, energy, sleep, and even immune response. Managing pH balance requires medical guidance. Consult your doctor before trying this, especially if you have kidney, heart, or blood pressure conditions. Use only as directed, typically no more than a few times weekly, and monitor for side effects like nausea or swelling. Regular blood tests may be necessary to ensure safety. 8. Calm skin irritation, expanded section. Aging skin often becomes dry, itchy, or irritated, whether due to medications, harsh weather, or conditions like eczema or psoriasis. For seniors, these issues can feel more than skin deep, affecting confidence and comfort in daily life. Baking soda may offer a soothing, natural option through a bath, soak, or paste. A 2019 study in dermatology reports found that a baking soda bath, 2 tablespoons dissolved in a tub of warm water, reduced itching and irritation in patients with mild eczema. For localized issues like insect bites or rashes, a paste made from 1 teaspoon of baking soda mixed with a few drops of water can calm inflammation when applied briefly. This gentle approach suits seniors seeking non-medicated relief, offering a way to restore comfort without complex treatments. I've seen patients find solace in this simple ritual, feeling their skin soften and their confidence return. Baking soda's alkalinity helps neutralize acidic irritants on the skin's surface, creating a less inflammatory environment. It's not a cure for chronic skin conditions, but it can complement medical care, especially for occasional flare-ups. For seniors with sensitive skin or those prone to dryness from medications like diuretics, this remedy feels like a kind embrace, a way to care for your body from the outside in. Beyond physical relief, there's an emotional benefit. Taking a moment to prepare a baking soda soak, perhaps in the evening, when you're winding down, becomes an act of self-care. It's a reminder that your comfort matters, that even small discomforts deserve attention. Avoid applying it to open wounds or broken skin, and rinse off after 10 to 15 minutes to prevent dryness. Consult a dermatologist if irritation persists or worsens, and limit use to once or twice weekly. Those with sodium-related health conditions should seek medical advice before using baking soda topically, as small amounts may be absorbed through the skin. Baking soda, plain and inexpensive, carries a quiet power, backed by scientific research, to support this journey. From easing heartburn and soothing gout to calming skin irritation and supporting digestion, it's not a cure but a gentle companion, offering you a sense of control in a world where medical treatments can feel overwhelming. How a teaspoon in water can become a ritual of self-respect, a reminder that your health matters. You are the wise steward of your body, and with that role comes the right and responsibility to explore options, ask questions, and make informed choices. Always consult your doctor before trying these remedies, especially if you have existing conditions or take regular medications. Baking soda is powerful, but like anything powerful, it must be used with care and under professional guidance. If this video spoke to you, share it with someone you care about. You never know whose life a little wisdom might touch. Take a moment to reflect and comment below, with one thing you've learned and plan to discuss with your doctor. Type 1 if you found this helpful, or 0 if you have feedback to help me improve. Don't forget to like, share, and subscribe to our channel for more content designed to help you live fully, authentically, and on your terms. Here's to small steps that make a lasting impact, to aging not as decline but as refinement. And to you, for choosing curiosity and honoring your health. Thank you for watching, and I'll see you in the next video.